When it comes to diagnosing valvular stenosis, not all imaging tools are created equal. That's why the American Society of Echocardiography, or ASE, has laid out clear, evidence-based guidelines to help us assess valve disease accurately and consistently. These methods are divided into 3 recommendation levels, based on strength of evidence and expert consensus. Let's break them down. Level 1 recommendations are your gold standard. These are the methods that are not only appropriate but strongly recommended for all patients with valve stenosis. They're your go-to, first-line tools, reliable, proven, and central to routine clinical evaluation. They include 1. Mitral Valve Area by planimetry, wherein you directly trace the valve opening from the parasternal short-axis window, MV level. 2. The mean pressure gradient, which is obtained using pulsed wave Doppler across the mitral valve. 3. Pulmonary artery systolic pressure, which is estimated using the tricuspid regurgitant jet, meaning the continuous wave Doppler is sampled through the tricuspid valve, typically in the apical 4-chamber window. And lastly, pressure half-time, which reflects how quickly the left atrium empties into the left ventricle. These tools not only confirm the diagnosis, but help classify the stenosis as mild, moderate, or severe. For example, a mitral valve area greater than 1.5 square centimeters is usually mild. Around 1 to 1.5 is moderate, and less than 1 is considered severe. Level 2 recommendations are for when the Level 1 method doesn't give you the full picture. These tests are used selectively, often to clarify more complex or borderline cases, or to guide further decision-making when echo findings are unclear. Level 2 recommendations include, first, the continuity equation. It's based on the principle of conservation of flow, that is, what goes in must come out. By comparing stroke volumes at the mitral valve and LVOT, we can calculate the mitral valve area, or MVA, especially useful when planimetry is unclear or technically limited. Next is the PISA method, short for proximal isovelocity surface area. This technique estimates mitral valve area by analyzing flow convergence on the atrial side of the valve. It's helpful in moderate to severe cases, though it requires good color Doppler images and experience in proper setup. And finally, stress echocardiography, which can be performed using either exercise or pharmacologic agents like dobutamine. This test evaluates how the valve behaves under stress. It's especially valuable in patients with exertional symptoms but normal resting gradients. Level 3 recommendations are not advised for routine clinical use. However, they may still play a role in research settings or rare clinical situations, especially when other imaging methods aren't available or are inconclusive. For example, cardiac catheterization is a Level 3 recommendation for assessing valve stenosis. It's not recommended as part of the routine workup unless transthoracic echocardiography, or TTE, is inconclusive or technically limited. Let's dive deeper into the Level 1 recommendations. The mitral valve area by planimetry is one of the most reliable methods, but also one of the most technically challenging to perform. It requires a good quality image, proper timing, and precise alignment, because you want to be at the leaflet tips. You'll want to be in the parasternal short-axis view at the mitral valve level. Tilt your tail inferiorly to get the narrowest opening of the MV that gives you that classic fish mouth appearance of the orifice. Scroll through your clip carefully and freeze it in mid-diastole when the valve is fully open. You'll usually see that the shape of the orifice is elliptical. Now you can start at any point inside the opening and proceed to tracing the MVA. In this example, our tracing gave us a mitral valve area of 1.97 square centimeters, which falls within the range of mild mitral stenosis. Click the link above to watch our full video on mitral stenosis evaluation. Thank you for watching. If you found this helpful, please support us by liking the video and subscribing to the channel.